welcome. I'm Thomas Richardson. I'm a clinical psychologist by training, and I'm an associate professor at the University of Southampton. I'm just going to ask my colleague here to introduce as well on the panel. Introduce themselves.
Yes, hello, I'm Meenakshi Shukla, and I'm an assistant professor of psychology at University of Allahabad from India. And today in this session, I'm going to be discussing about a multinational study that I and my team from different countries, we conducted during the COVID-19 pandemic, in the first phase of the pandemic, actually, when the first lockdown was imposed in most of the countries. And there were very interesting findings, not just related to finances, but several other concerns of youngsters, the adolescents and youngsters during that time. And unfortunately, we don't have data right now from Nepal and Germany, who are also party to this multinational study in the beginning. But we do have data from India and the United Kingdom and Israel that I would like to talk about later.
Okay, thank you very much. So yes, this topic is on a research perspective on money and mental health. So I am going to start talking a little bit about my research, about money and mental health, how it developed, how that links with technology and what I'm kind of working on at the moment. And then I'm going to hand over to Meenakshi for her comments about her research, and then we'll have a little bit of questions, discussion, Q&A. So, I mean, I don't have to tell you all that it's certainly in the UK, but in a lot of countries at the moment, there's a really difficult financial situation. In the UK, we've got high levels of inflation, especially for food inflation. Wages aren't keeping up with that. We've got high levels of food bank usage, and we've got kind of reduced GDP because of Brexit, etc. So there's a very difficult financial situation for a lot of people. And the number of people who are accessing debt and money advice in the UK is skyrocketing. It's by one estimate, it's something like 10 million people in the UK need debt advice or financial advice. It's like about, it's about 40% of the adult population. So it's a huge problem. So my research on money and mental health started when I was training to be a clinical psychologist a few years ago, almost by accident, where there was a lot of debate in the media in the UK around 2011 about whether to increase tuition fees for students. Lots of debates about whether this was a good thing or not. Nobody was talking about the mental health. And I thought, well, surely this is going to impact mental health of students if you're tripling tuition fees. So I wrote a letter. So that became my thesis, basically. And what it showed was there wasn't a huge impact on mental health for students who had the increased tuition fees. There wasn't a huge impact, but struggling to pay the bills had a huge impact over time on symptoms of depression, anxiety, alcohol problems, eating disorder risk of psychosis, really significant problems. And this was longitudinal, so this was over time. To an extent, it worked both ways, and it was a vicious cycle as well. For example, money led to worsening eating disorder symptoms, but people who were struggling with their weight and their body image, their finances also deteriorated over time. Also, that tuition fees increase was in the first year at university. I'm hoping when students are at university, they're trying to enjoy themselves and not worry too much about the student loan they're going to graduate with. So I'm trying to do a follow-up now to see, well, where are those people now when they're kind of in their late 20s? And some of them have 20 grand debt and some of them have 60 grand debt. So it's kind of moved on. I've worked in the NHS and the National Health Service in a community mental health service. And I worked in a city with a lot of deprivation and a lot of poverty. And I wanted to apply this to also some more severe and enduring end of mental health. So one of my other research interests is about bipolar disorder. And that seemed like a big gap in the literature for me, because we knew that everyone, it's like common knowledge. It's in the diagnostic criteria for mania that when people are unwell, they spend lots of money. But there's not a lot of academic research about it. So I did a small study at that, and we were looking at the psychological mechanisms as a psychologist. That's what I'm interested in. And yeah, we were looking at that, and we found it was a combination of qualitative and quantitative. And there's some really interesting stuff came up. It was assumed that impulse spending is something that people do when they're manic, but actually people were saying it's not just that. It's also comfort spending. When I'm depressed, when I'm anxious, I can just buy things to make myself feel better, and then it backfires because I get in more debt. And people saying about excessive generosity as well, showering their loved ones with gifts and giving. Some people saying they literally gave away their life savings to charity. And there were lots of kind of psychological mechanisms in this. So, and it wasn't just about mania. It was also about depression and anxiety and stress. And I've got a whole model around this. And whenever I present this to people without bipolar disorder kind of say, well, that could be me to an extent. I comfort spend. And so there's also people avoiding their finances when they're depressed or anxious. So they kind of dig their heads in the sand. There was something about self-esteem. If I can't buy new clothes, if I can't go on holiday. And there was also, this is something I'm really interested in, is that I think lots of people assume that impulse spending in bipolar is completely random, and I don't think it is. We found that actually strong beliefs, so people with bipolar tend to have very high standards, lots of beliefs about I need to achieve, lots of very high goals, and that predicted impulse spending over time. So did being broke. So what I think often happens is that people are broke, and people with bipolar get a get rich quick scheme. They have a very overly ambitious idea, and they spend money to make money. So it's not entirely random. Often there's a reason. I'll give an example from my own experiences. I have bipolar disorder myself as well. And when I was 18, the night before I was taken to hospital, which was a good thing because I had a meeting with the bank manager but the next day for my business. I'm glad that didn't go ahead. So I brought 5 massive African djembes, and I am a drummer, and that might seem like a completely random impulse buy, but actually, for me, it was part of a wider business. There was a goal behind it. So there's often a theme, there's often a pattern. So I am doing various kind of projects here at the university where we are trying to think more about supporting people with mental health problems and the role of technology as well. So I'm doing some work about deprivation, and do people live in deprived areas? Do they do as well in therapy? Not really. Something that Becky Insta is helping me out with, which I'm quite proud of, is there's something called Space for Money Worries, which I developed. It's computer-based therapy, CBT, cognitive behavioral therapy. So it's 9 sessions, online self-guided CBT, to try and help break that link between money and mental health, and try to use that digital for a positive. And it's been used in the NHS and outside of the NHS, which is really great. We've had 1,700 people in the UK use this so far, and a preliminary study we did showed it reduced symptoms of depression and anxiety, and it reduced how much people worried about it. So a lot of people can access that for free. And something myself and Becky are working on is applying for a grant to see if can we get that into debt advice outside of the NHS, because people who are in debt are more than 3 times as likely to have a mental health problem. I'm also doing some work about the role of technology and bipolar disorder with some colleagues from Dublin and from Penn State University. And we're trying to look at the role of technology. So we've collected some data from about 500 people with bipolar. And first thing I think to say is, the one estimate is that 12% of people with bipolar have gone bankrupt, which is huge. Mm-hmm. Another, we've actually suggested it's even higher in some data that we're currently writing up. 21% have gone bankrupt, 21%. And in the UK, in any one year, it's about 1 in 420 people go bankrupt. So this is huge. But another 37% have nearly gone bankrupt. They've seriously considered it. So you're talking about half of people with bipolar having gone bankrupt or nearly. And technology does have a big role to play. Unfortunately, technology is a big part of the problem. 81% of our sample said that technology makes it easier to overspend. And the majority said that online purchases were what they usually do for impulse spending. The vast majority. The problem is that with technology, everything is going frictionless. It's going contactless, right? You can buy with a ding on your phone. You can take out a loan just from an app. You don't have to go into the bank anymore. And for most people, that's great. That's convenient. But if you're prone to impulsive spending, that is an absolute nightmare, because I have worked with people who have taken out a 10 grand loan and spent it in a day. Just like that, gone. You know, it makes it so much easier to spend this money. So we are trying to work on developing solutions using technology as part of the solution rather than part of the problem, because I think that is really a really big part of the problem. And actually, most people in our survey wanted technology to make it harder to overspend. They wanted to make it actually harder. So positive friction. In the UK now, a lot of banks have gambling blocks where you can opt in to not be able to gamble using your debit card, which is great. I want to try and see something similar with bipolar, but it's complicated. Okay, so that is a bit of an whistle-stop tour of where I'm going with my research. I've got a few more thoughts about where I think as a whole the research needs to go, but I'm going to hand over to my colleague now to talk about her research.
Hi. Okay, so during the first lockdown of the pandemic, and in India, it started somewhere in March 2020. In the UK, it was somewhere around March 2020, and then the lockdown phases were just implemented, then they were relaxed, and this went on. And in the Israel, it was the same around February to March 2020, the lockdowns were imposed. So we decided that because undoubtedly this lockdown and the pandemic, all these things have been really stressful for all kinds of populations. But we were really focused on the adolescents and young adults, because this is a crucial phase in their life when they are transitioning. And at this time, worries regarding such huge pandemic, which was such a new thing for everybody across the world and kind of shocking. So this can have added impacts. And the worry, as you know, worries are a kind of a transdiagnostic concept, because worries are common to several different mental disorders. And so we just decided that we have to look into the worries of youngsters during that time. And we started a longitudinal study on the baseline data that we collected in Israel, in India, in the UK. We developed a short survey on Qualtrics online, and then we asked participants to volunteer and participate and report on their worries that they have been facing in the last 2 weeks during the pandemic. And we gave them free text field so that they can it's also a way of, just expressing if they could not just say their worries to other people. So we just gave them endless limits that you can just write as many words as you want, and you can just express all of your worries that you have been facing. And we asked them mainly to report any top 3 worries that they have been facing in the last 2 weeks. And when we analyzed the data, it was really interesting to see a lot of commonalities across the countries, even though they are financially different. The financial standing is really different. For example, India is still a developing country. Israel is kind of developed, but not as much as the UK. So there were clear differences in the financial standing of each country. And also these are culturally different. And the culture for, like UK is a completely individualistic culture country, but India has a collectivistic culture. And Israel is somewhere in between. It's a blend of two. So we wanted to see how the worries differed across these factors. And when we saw education was the topmost worry for participants from all the 3 countries. And this is likely because we considered adolescents and young adults who were aged between 12 and 18 years. So this is a crucial phase when they are so much into education. So maybe that was a main factor that their studies are being hampered. But the way that studies were being affected was interesting. For example, in the UK, they were just mainly concerned that we cannot meet our friends, we cannot go physically to school, although online classes are going on and everything. But in India especially, they were concerned that they don't have the resources to participate in online classes. In Israel, again, it was somewhere in between. Some reported that, yes, I don't have the required resources to attend classes online. And some were just concerned that I'm just forgetting all the content that was told to me in class, and I don't know how to face my examinations and all that. But this was the topmost worry. Academic worries were the topmost worry. As much as 73% of the participants from India reported this worry as a topmost worry during those last 2 weeks. And after that, if we see about India, the next highest worry was that they were concerned about their and their parents' and families' physical health during the pandemic. And this again seems like a valid concern because it was the COVID period. But this concern ranked somewhere 5th or 6th in the order of worries for the UK participants, which was interesting. So what was their second most important worry? They were more worried about social relationships. Now, this is interesting that we expected this should have been a topmost worry for Indian participants, being from a collectivistic culture, that they're not able to interact in person with the participants. But this was really something that shocked us. We were not expecting this to happen, but this was the finding. Social worries were there for Indian participants, but that ranked 3rd in the list of worries. Moreover, Indian participants were also worried about their recreational activities, outdoor games. And there was a significant gender difference in this because male participants were more concerned about this. They wanted to go outside to play in the fields, to go meet their friends. And this was not common with Indian adolescent girls or other participants from different countries. One interesting thing that I noted, like this was just for the Israeli participants, that they reported, 34% of them reported fear of the corona. And the responses were simply like, I'm afraid of this pandemic, just like that. Not giving an exact reason why. Are you concerned about your health? Some people not being in your life because of the pandemic, some other factors being affected. They just said, I'm totally afraid of this pandemic. This was a common response for many of them. Then what we found something unique about UK participants was that many of them reported financial worries, which is interesting because financial worries were reported by Indian participants as well. It's kind of a poor country. So many participants were concerned, about 25% of them were concerned about finances. But their financial worries had something unique in that the Indian participants were not just concerned about their financial prospects or their family's financial prospects. They were also concerned about what is happening across the country. For example, many reported that I'm really concerned about the migrant laborers. How are they going to survive in this time? And other sections of the population, the poor, the people who are not able to earn, who are handicapped, and like that. The UK participants, it was interesting to note that they had some other sorts of financial worries. For example, people said that I'm worried because I have not saved enough to buy a pet. Or I'm worried because I'm just being bored during the pandemic and I'm just splurging all my money in online shopping and like that. So there were financial worries, but depending on the financial condition of the country, we can see that while Indian participants were more concerned about being able to purchase essential commodities and how the weaker sections of the society are worried and how will they fare financially, UK participants were not that concerned about basic necessities because maybe they are well off in that matter, but they were more concerned about how they are spending their money or kind of wasting their money just to get rid of their boredom. So this was a crucial factor. And we also tried to explore how these worries varied across genders, across age groups, across socioeconomic status. And the most surprising thing of all was that throughout the 3 countries, we did not find a single significant difference with respect to socioeconomic status. That should have been evident. Financially, if you have a different standing, if you are from a affluent family or if you are from a poor family, there should have been some differences in worries. But we did not find any significant difference across the 3 countries, which was really surprising. And we are still pondering what could be the reason behind that. Yeah. So this is just the gist that I'm giving, but yeah, there's so much more that I can discuss on the topic, but I would like to take questions if you have any or discuss further.
Thank
Yes,
you.
sure.
Craig, you had a hand raised, I believe.
Yeah, I was just waiting to be acknowledged. Okay, all right. So, Meenakshi, I hope I pronounced your name correctly, or maybe
Yes,
I should
that's
say
right.
Dr.
Yeah.
Shukla. Dr. Shukla.
Yeah, that's fine.
Okay. That last insight that you mentioned was really interesting.
Mhm.
What it made me wonder, and I just want to put this past you as a hypothesis, could it
Yeah.
be that one's current, let's call it worry profile, has
Okay.
less to do with their current socioeconomic status and more to do with that of their broader community and families, and particularly family of origin. So, and Becky, this gets back to the discussion we were having the last session.
Mhm.
No matter that I am upper middle class, at least I think of myself that way, I was born into a family that was lower working class, notwithstanding being American, of a highly marginalized and lower caste group, right? So that even though I've achieved a certain status in my life, I still carry the foundational worry portfolio of the community that raised me. And we were also worrying, right? No pun intended, in our last session about the degree to which we then give that same worry portfolio to our children and our grandchildren. What are your thoughts about that, hypothetically?
Yeah, I think that could be a reason. But what we thought was, because we asked them to report on their worries in the last 2 weeks in the wake of the pandemic. And although many people reported that they had significant financial worries, like my father is doing very poor in business, my parents have lost their jobs, and like that. But it was interesting to know that why there were no significant differences across socioeconomic status. I mean, the poor people obviously should have been more concerned about not being able to procure daily necessities, that are essential for survival. But that was shocking that we did not find any such differences. Even the poorest of the people were not that concerned, at least not significantly. Their worries were not different from those of the higher class or the upper middle or the middle class. But there should have been. I mean, we were expecting that because many people lost their jobs. There were so many closures. Many daily wage workers were not able to earn during those times. So it was kind of shocking that why the differences did not emerge where we were expecting them to be. But yeah, I get your point. That is important, that obviously your socioeconomic status, your general standing financially cannot have a direct impact, so to say, in what a person is currently feeling or worrying about. Maybe that is a factor. Yeah.
If I could just share some of my thoughts on that, please. Thank you, Craig.
Yes.
Yeah, it's interesting. I mean, first of all, what you were saying to Shukla about the research, and it made me think. I put a list to a journal special edition, I guess, edited, and there were quite a few papers there about COVID, and there were 2 from Bangladesh. And me sitting here in the UK with my, high income privileged perspective, it was just quite shocking to read that one of the variables there was no income during the pandemic, no income. And, in the UK, we had, what's it called, furlough scheme, so the vast majority of people in the UK have some level of social security, even if it's not a lot, they have something. So to see people with no income at all, and I think that relates to that question about, the socioeconomic status. So the thing is that, I started researching and saying I'm interested in debt and mental health. And the more I've researched, the more confused I get, because everything's related to everything. And it's not about the debt per se, it's about whether you can pay the bills. And it's not about debt per se, it's about how much that relates to your income. £200, $200 debt is crushing for some people. £10,000 debt is not a big deal to some people. And now that's partly maybe, like you're saying there, Craig, about where you come from and what money means to you and your beliefs about money and debt. But it's also about your income, and it's also about how you make sense of that and how much you worry about it, which is what I'm interested in as a psychologist. So in terms of your finding about no socioeconomic status differences, well, putting it bluntly, the people who were very poor already, maybe they were better, it wasn't as much of a financial shock, the COVID pandemic, to be blunt, because they're used to coping with unstable work, low paid work, etc. You know, that's what I'm kind of thinking. And it's interesting, look at these variables. Actually, you know, debt is very strongly linked to mental health. A meta-analysis I did showed you're more than 3 times as likely to be in debt. But actually, debt is a problem for the more middle classes, because if you are on low income or no income, you can't get access to credit. So, and I think this relates to this conversation, that this is one of the things I'd say for the research agenda, which I'm increasingly looking at. We need to look more at those demographic differences on the relationship. I'll put the link in the chat, but I republished a report about the link between money and mental health in minoritized ethnic groups in the UK. And, you know, lots of kind of interesting and quite worrying themes there about, you know, maybe a double stigma in certain communities. Where do you go for financial advice? All of that. But actually what I found, and I'm guilty of this, when we look at it in research, we control for age and gender and ethnicity. We don't look at if there are any differences. And there's not many studies that look at, actually, does money impact you differently depending on your demographics? You know, so one study in the UK showed that actually the link between income and depression differed. It was different between the white participants, the Asian participants, the Black, African, Caribbean participants. We need to look at that more. We need to understand what that's about. Craig, I don't know if you've got some thoughts there. You look like you want to come in.
Yeah, so Thomas, I'll stick with, there are 2 pieces of research that I've seen that resonate with what you say. So one, I recall that during the pandemic, it was sort of counterintuitively found that people who grew up in more chaotic households actually were more resilient in the face of the pandemic, because they had a set of habits that under normal times looked dysfunctional, but under the chaos of the pandemic, actually they were equipped to deal with things that were causing other people to just collapse. It's an unfortunate, fortunate, I guess you might say. The research that we've seen here in the US around deaths of despair, this dilemma that we have where white men are ending their lives more readily than the general population because of despair and the means I'll set aside for now. But what was curious is that when they put that same survey to African-American men, what it was found is that African-American men, while distressed about many things, were distressed in different ways than white men, having to do with social expectation around privilege and entitlement and being resourced. And so expectation of what would happen in a situation is a very relevant factor, and is something that you somewhat alluded to, Thomas.
Yeah,
I'll leave it at that.
I'm used to this. I'm used to coping with uncertainty, and I'm used to coping with living day to day financially. Yeah, I agree with that.
So
Meenakshi,
yeah,
have you got
maybe
any
this
thoughts?
is yes, maybe this is a sort of resilience that they develop because of the situation. For example, across the 3 countries, what we noted that is Israeli participants, they were least bothered with the pandemic, least compared to all the 3 countries. And when we tried to explore what could be the reason behind that, then it's just hypothetical, but maybe because they have a worse socio-political environment there compared to the other 2 countries. So they are already used to so many terrorist attacks, so many political upheavals, that curfews and being put inside homes and being restrictions being put on using, you know, public transport and other stuff. They are used to it in their daily life. So maybe that was not that shocking for them to be inside their houses, to be indoors for a longer time due to the pandemic. So they were not as shocked as the participants from the other 2 countries. So maybe there's some sort of resilience that they develop being in that kind of environment already. So that may be the same with the financial situation, perhaps.
Yeah, we need a paper on the unfortunate fortunate or something like that.
Just following on from this about social, and I think there's some comments in the chat there from Erin about community, double-edged swords and community, role of community. Yeah, I think this is again something we need to look at is the wider societal impact. So, the report I put the link to in the chat about minoritized ethnic groups in the UK, that was definitely a theme that showed up. Is that so Meenakshi, you said about the different sort of collectivist versus individualist cultures, right?
Right.
And they were saying that in, for example, South Asian community in the UK, who might have a much more collectivist, that can be for money and mental health, both a positive and a negative thing, because on the negative side, you might be liable for a family's debts. On the positive side, that means you've got a bit of a buffer if you get into financial trouble.
Right.
On the positive side, you have access to I guess non-mainstream sources of loans. If you don't have a poor credit, you might be able to, that's like community organizations through your mosque, etc. On the negative side, that also means that from the money advisor's perspective, there's different priorities, because you will say you need to pay your rent, and they will say, I need to donate to my mosque, for example. So there's definitely some cultural things that need to be underpicked. And I'm thinking as well, I mean, it's great that your research was with a range of countries, because a lot of the research, like most research about mental health, is with the kind of high income countries. But it is important to say that, there is this link between money and mental health across the whole world. This has been shown not just in high income, in India, in various countries, in Uganda. There is a lot of research across the world showing this. But yeah, I think we need to think more about that. And another societal thing I'm getting increasingly interested, which, and actually you touched upon a little bit, is inequality. And for anyone who hasn't read it, it's a few years old now, but it's still very relevant. The Spirit Level looks at the link between Craig's doing a fist bump. The link between money and mental, the inequality, and I think that's the really important thing. So the more unequal a society, the higher the prevalence of mental health problems. Now that appears to apply only to the developed world. The high income countries. To the kind of low middle income countries, it doesn't apply so much. That so for example, Brazil and South Africa are actually probably the most unequal countries in the world in terms of income. But there's not that link between mental health until you go to the kind of developed countries. So essentially, once a country gets to a certain wealth level, getting richer doesn't make any difference to the mental health at a population level. What makes a difference is that difference between rich and poor. I want to understand psychologically why that is. I don't think we really know why that is. There's research I've done about the psychological mechanisms, and I think overall we need more. So it's not so much how debt you're in, it's how much you worry about it, how stressed you are about it, how hopeless you feel about it, how ashamed you feel about it, how much you're actively coping. These are all really important mediators we can work with. Even as a psychologist, I can't change the car crash that is the UK economy. Hopefully I can work on trying to reduce the kind of the worry, the hopelessness, the shame. And that's the intervention I've developed based on money worries. But I really want to know, and I'm interested in everyone's thoughts, psychologically, why that inequality is. But I think it makes sense to me that if you are struggling to pay your kids in the cost of living crisis at the moment, and then you've got someone across the road who is nice car, no money problems, going on holiday, that's tough. And there's a lot of self-criticism and shame and resentment that come with that. Okay. Oh, we're getting into it, aren't we? Any other thoughts? Any questions from anyone?
I guess one thing is the divide being furthered with digital currencies and if fintech financial data being available for some to link with healthcare and not for others to have the same sort of potential opportunities, but obviously there's a ton of risks there. But becoming a cashless society in some aspects, but also not even having a chance to have financial data or your own personal journey of finance to be included in your mental health support. Not a question, more of just an area.
Yeah, I think no, I agree. We need to be aware that the digital, I think I'm all for for fintech and for health tech, and I think digital solutions have huge potential for both money and mental health. And like I said, we're trying to join the two and think about how we can use technology to actually reduce the risk of impulse spending. But yeah, we do need to be aware that it does have the potential to increase the health inequalities. But yes, internet access is very, most people have access to it, but we still need to be kind of aware of that. I'm hoping it simplifies things, because when you're depressed and you're anxious, it's very hard to budget. It's very hard to even open a bill. So, there is the potential actually that this technology can make it much neater and easier to actually look at your finances and budget and that kind of thing. Although I'm always aware of saying we just need people to budget, because I think, as someone put it very clearly to me a few days ago, people who are poor are very good at budgeting because they've had to do it their whole lives. Fair point. B, I think there is just the blunt truth that at a certain level of poverty, it's not about budgeting, you just don't have enough to live on. So, okay. But yeah, we need to be aware of that, Becky. I agree.
Yeah, and then if I can bridge over a theme from our last session where we're talking about scarcity, right? And scarcity is a mindset that one suffers with regardless of socioeconomic, right? So I've met very wealthy people who carry a lot of depression and anxiety because even with great wealth, they still have a sense of scarcity. And then I've met people who are much less wealthy, who I think you kind of said that their mindset about their debt or their lack of whatever, they're kind of more relaxed about it, right? I'm not ashamed of it. It's my circumstances. I get along in life. And in some ways, they're actually more satisfied with their life than people who have great wealth. Have you found in your research that there is this strong correlation between, I guess I'd say, mindset of scarcity or abundance that kind of cuts across, that the abundant are less mentally, psychologically, and emotionally stable, regardless of socioeconomic status or circumstances otherwise? Kind of a mind over matter sort of proposition? Or is there not a strong correlation that's just kind of a hypothetical, you may see it, you may not see it? I'm interested in your thoughts about that.
Meenakshi, anything you want to come in with before I share my thoughts?
No, because in our research, we did not really explore this kind of factor, so I cannot directly speak to it. Yeah, that could be a factor, because this is a real life incidence that I have experienced too. Because if you have too much money, that does not mean that you psychologically feel that you are affluent. What you psychologically realize for yourself, that is more important. Even very poor people, and they'll be happy going on with their life, that I have sufficient, God has granted me enough for me for every day, and that's fine with me. So yeah, that happens. That really happens. Yeah.
I mean, I haven't directly researched that, but I certainly think that would make sense. And it loops back to a conversation before about, I've certainly worked with people clinically who, this loops back to what you were saying earlier, Craig, come from poverty. And I don't. I come from a comfortable middle-class background. That's why I'm interested in this. And I've got other colleagues who are interested in this because they come from a much more poverty than me. But I've certainly worked with people who have a real strong need to do more and earn more because, it was literally, to put it bluntly, a matter of life and death. And so there was a real strong need that I have to achieve. And maybe they felt like they had to get educated, get a good job to dig their family out of poverty. And even when you're in a comfortable job and a comfortable house, that mindset is quite hard to ditch. And I think it relates to what I'm saying about inequality. And I did a whole TED talk about society's messages about achievement and how that fuels bipolar disorder. And actually what Meenakshi was saying earlier about the individualist versus collectivist cultures in the world, societies which are more individualist and goal focused have a higher prevalence of bipolar disorder, such as the UK and the US, right? So there is something quite toxic about cultures which say you just have to work hard enough and you can do anything. The American dream, whatever you want to call it, right? And that's pretty toxic, I think, because that's just not the case. And the media shows us one person who had a unrealistic business idea and became a billionaire. And it doesn't show you the 99 people who lost everything. So it's very, and that's a very bipolar thing, but I think generally it's the more, it's not enough. And I don't feel comfortable. I saw something from Gene Simmons, the founder of KISS, who's worth hundreds of millions. And he said, it is like an addiction. I just want more. It's never enough. And you can have millions, but if you're comparing yourself to the billionaires of the world, it's not. So this materialism, and I think the stuff we see in our media and our social media about, living my best life, look at my holiday, look at my new house. It's very toxic. We've got to be really careful of that. So yeah, I think the research kind of shows, at a society level, like I said, it's more about once a country's rich enough, it's more about inequality. At an individual level, there is a certain level of, absolutely lift people out of poverty. I think there's definitely a mental health call for, there's a case to be made for like universal income, which is being trialed in kind of some Nordic countries so that people have a flat amount. So but then at a certain level, yes, it's unconclusive whether getting richer will make you happier. It probably won't. And a lot of people will win the lottery and then they're miserable. And if anyone's watched Succession, there was an article by a therapist who specializes in ultra high net worth individuals. And he said it's completely accurate. They are rich, but they are absolutely miserable. So yeah, there's a nice balance, a nice thing where you're comfortable enough to have a comfortable life, but I don't think getting richer will make you any happier. Craig.
Yeah. So the second to last point you made brings up, I think this comes out of the research of Seligman at UPenn in positive psychology, the $75,000 premise, which is that $75,000 is the point at which you're happy, but you can't be much happier. And that a lot of it has to do with, there's this percentage of how much money you make relative to your neighbor and friends, that happiness when it comes to money has more to do with where you are relative to friends and family than to the society at large, which says a rather dark thing about us, I think, as human beings, but it seems to be what it is.
Absolutely. There's a neighborhood effect. And I mean, I know some people who have come into lots of money through redundancy, and actually it's made them pretty mentally unwell. And I've also, I remember a story of someone I know whose father, who was an immigrant to the UK from a very poor kind of, the Caribbean community in London, won lots of money on a scratch card. And actually it ruined his life because he kind of felt completely isolated and not part of that community who were kind of connected through poverty, basically. And then you suddenly win this, huge amount of money and you don't feel like you fit in anymore. Yeah. So, it's complicated, isn't it?
I've just noticed Aaron's dropping some really interesting comments from Mind. Did you want to say anything at all, Aaron, to those comments? I don't want to put you on the spot, but I thought give you the chance because we've got about 10 minutes left in the session.
Yeah. So I think energy poverty, absolutely. I mean, they're going up a lot in a lot of countries. The UK has the highest energy bills in the world. Woohoo. And even before this current level, people in the UK with mental health problems were 3 to 4 times more likely to struggle with fuel poverty and to be in debt to companies. So there's an absolutely something there. So scarcity from my perspective, As mental health. Yeah, I mean, I think I absolutely agree, Erin. There's this thing in psychology of like Maslow's hierarchy of needs, and at the bottom is security, and at the top is kind of well-being. And yeah, it's very difficult to do therapy with people about their mental health when they might be evicted and they're struggling to pay. It's a question of priorities. Absolutely. Is there anything else you wanted to say, Erin, on that?
Got a hand up now. So yeah, Erin, if you want to unmute yourself.
Yeah, sure. Apologies, I've kind of lost my voice, which is why I was just being a keyboard warrior instead. Yeah, I mean, it's essentially my role at Mind is looking at how we can break the two-way link between mental health and poverty. So a lot of what we're doing is looking at, across the board through our services, our campaigning, our information provision, like what is it that Mind can contribute to that. And I think that a lot of what we're trying to do, and it kind of feeds into your point around Maslow's hierarchy of needs, is connect ourselves in with that broader support network, so that there's almost like, it's a classic phrase, isn't it, but like no wrong doors, so that if someone, let's say for example, goes to a food bank, well actually they can then receive mental health care like through either a signposting or actually a physical kind of Mind person being there. And I think we're in a project with Trussell Trust, the food banks and citizen advice to try and kind of look at what that looks like on a local level, but also at a national level through kind of helplines as well. And the kind of preliminary evidence is that it's working quite well. But I guess, I'm just here to kind of see what else it could be that we can do. And I think that scarcity thinking and internalized shame and self-stigma, which we've been talking about in the chat, are those kind of key barriers that we're looking to try and overcome, really.
So I think, first of all, great work. Let's talk. I was at a launch in London last night, Money and Mental Health Policy Institute, which is a think tank specifically set up around this. And they're doing really great work. I'll put the link in the chat. And the whole thing last night was saying, for psychological therapies in the UK National Health Service, let's try and get debt advice embedded, and let's join that up, because services are set up as mental health here, money problems here. My view is they're so overlapping, it's a bit pointless trying to work with that, and people fall through the cracks. So absolutely, we need as much integration as possible, and that's what I'm trying to do. We're trying to get space for money worries in debt advice services, and I'm doing some work at the moment where we're getting debt advisors to ask about suicidality, and actually it's going really well. And they were very anxious about asking that question initially, but they're getting used to it, and they're identifying lots of people who wouldn't have spoken about that, because if you don't ask, you don't know. So no, I absolutely agree with that. And I'm doing a local project about the cost of living and mental health, and we are interviewing the debt advisors, the food banks, the NHS, and trying to think about how to best support together. So we're trying to do some kind of one-stop shops here in Southampton, where you can go to like a food bank, but you've also got a money advisor there and someone from the NHS. The closer these services work together, the better. Absolutely.
I think that's definitely talk more after the session. The only other thing that I just wanted to throw in is that something that we're looking at is, as opposed to kind of looking at deficits in local communities, is actually taking more of an asset-based community development approach. So building on brilliant assets, and by assets, a lot of the time we're finding that actually just means brilliant people in the local area who have a lot of connections, rather than assets in terms of buildings or financial assets. And actually taking that kind of more building on the positives approach, but particularly applying that to money and mental health. So we're quite early in that journey, but it's something that we're kind of in the scoping phase of, and it's feeling there's a lot of excitement around it as well, I think, and trying to connect in with any experts around that as well.
So I have a quick question. So Erin, does this get at the topic of teaching communities how to leverage the ideas of, I'll use mutual aid and solidarity. Those are the terms I'm most familiar with, so that they create a buffer against the scarcity of the larger economy. I'd read this case a few months ago it was about Norway, and they were looking at how some part of the Norwegian population is less negatively impacted in many areas of their lives by larger fluctuations in the global economy. And they were talking about it comes of the fact that as a normal process of their local society, they always engage in the money economy and the barter economy. So they have a feeling that even when money now becomes scarce, we've got this other economy that bolsters us and thus creates a sense of abundance. Is that kind of what you're getting at?
Yeah, kind of building on some of that. So we did some work with Co-op a few years ago on what makes a community more sort of resilient than they should be. I'll try and share the link afterwards. But one of the things, I can't quite remember, there's kind of 5 factors. I'll post it in the chat afterwards. But one of the things that's really interesting to me is even in those, I think it was 5 communities we focused on that were kind of super resilient or more than expected to be based on kind of deprivation, etc., is that even in those resilient communities, there were certain groups being left behind, and they included people facing deep poverty, certain racialized identities, LGBTQI+, and it's even within those resilient communities that those groups still being left behind. So that's something we're trying to build on with this kind of asset-based community development approach. But yeah, completely that in terms of looking at, you know, what makes communities more resilient. Not always love the word resilient. I've got mixed feelings around it, but it's the easiest word to use, isn't it?
Yeah, I just wanted to, it's really interesting hearing you both talk, and I think just to go to Becky, I know you love a hip hop quote, but the more money, more problems, I think comes to mind. But I think my personal experience, I've done a video just basically around the look at poverty, social injustice and racism, and the topic of mental health. And I think I'm currently delivering training for 100 youth practitioners, like leadership training around, who are on the front line, who are talking about the direct issues affecting them. And one of the things, I think this does relate to money, certainly, is just the access to basic services. Like, you know, just actually the reason a lot of these statistics, or the reasons a lot of these things aren't being reported, is because people can't actually get a diagnosis, can't get seen by someone. A lot of the mental health services don't recognize symptoms that are clearly, you know, I mean, the eating disorders, throughout I deliver mental health first aid training, and we go through a lot of research and a lot of statistics, which there can be disparities there, but yeah, certainly the approach or even the action of getting a diagnosis, there's a disparity because the mental health services aren't there. And often money in that respect can affect, because it sometimes depends on what road you live on, not even your postcode or your city or borough, but what road you live on. But even after what road you live on, often the NHS, you know, whether you can afford private healthcare or whether you can't. And I think that's a really big divide. So even when we talk about that £70,000 figure, not necessarily making you happy, but it actually getting you to a point where you can get therapy or you can address these in a non-intrusive way. There's another statistic just to bring that back, and it's relevant to class, but also racism, is that even at that point of crisis, the likelihood of you in certain areas, the likelihood of you being prescribed medication for an issue first off the bat, or being prescribed therapy. And I think that's relevant within class and money, but it's also very tangibly relevant to a person's race. And I think a person of color is 4 times more likely to receive medication or over therapy. And we know that it can be a spiraling effect after, you know, if you're medicated for something without looking at the core issue. So yeah, even though I understand that money or affluence doesn't stop people suffering, I think even what we see in the UK is that disparity in actually even getting the person that initial, like, basic care, or even that diagnosis, to that point of diagnosis before that start of recovery.
Yeah, thanks, Ben. Thank you.
Agree, yeah. All right. I think we're about out of time, haven't we?
No, I got lost.
Yeah. Well, thank you very much, everyone, for coming. Thank you, Dr. Shukla, for your really fascinating research study, and for Becky for inviting us. And thank you all for your very insightful comments. I could discuss this all day, but there's other talks for you to go to. Thank you.